Okay. Hi, everybody. I'm Lee Crosby, registered dietitian with Physicians Committee for Responsible Medicine and Barnard Medical Center. And I'm the lead dietitian on the Let's Beat Breast Cancer campaign. So thank you so much for joining us. Dr. Vanita Rahman will be joining us here momentarily, and we're going to be answering your questions about breast cancer and nutrition. So be sure to leave your questions in the comments, and we'll get to as many as we can. But first, let me introduce you also to the Let's Beat Breast Cancer campaign. If you are not familiar with it already, it is an educational campaign that we are using. We have Dr. Christy Funk here spearheading it. Well, not here spearheading it with us, but as our main spokesperson for getting the word out that there are evidence-based steps that women can take to reduce the risk of getting breast cancer or of having a recurrence. And those 4 steps are: first, choosing plant-based foods; second, moving more, staying active; third, limiting or avoiding alcohol; and fourth, maintaining a healthy weight. It's as simple as that. As we all know, these can be a little more challenging to implement. And of course, there is no magic bullet, but if you follow these 4 steps, you can substantially reduce your risk. So if you haven't already, I encourage you to go to letsbeatbreastcancer.org, take the pledge, and you will get not only a cool free e-cookbook, but you will get an opportunity to win a grand prize pack from one of our awesome partner, well, with lots of prizes from our awesome partner organizations. So again, I also want you all to get excited and keep watching, because after the Q&A, we are thrilled to be sharing the world premiere of the Let's Beat Breast Cancer Celebrity PSA. But first, I'd like to bring in Dr. Vanita Rahman to join me to answer your questions on diet and breast cancer.
Thank you, Lee. I'm really excited to be here with you for this very important topic.
All right, so let's get started with questions. Dr. Rahman, would you like to take it away?
Yeah, so we have a question here, and it is breast cancer genetic? Women have been hearing about the BRCA1 or BRCA2 mutations, which are associated with an increased risk of breast cancer. But what we know about from research is that only about 5 to 6% of breast cancer is related to a specific genetic mutation. That means for the majority of the women, there's no clear-cut genetic mutation that has been identified, and it is likely a combination of all of these lifestyle factors that we are discussing today. Back to you, Lee.
All right. Thank you, Dr. Rahman. All right. So our next question is, and I hear this one a lot, is does soy raise the risk of developing breast cancer? And the answer is, what do y'all think? Yep, no, it definitely is not. In fact, the opposite is true. It is linked to a lower risk of getting breast cancer and a lower risk for survivors of having a recurrence. I'm just going to get a little bit nerdy with the numbers here, but in 2013, researchers analyzed data from 22 studies. They were using a technique called meta-analysis, which I love that. It's just right. It's like big study. They found that among Asian women, those who consume the most isoflavones, which are some cancer fighters found in soy, had a 32% lower risk of breast cancer. And that protective effect was for breast cancers, both premenopausal and postmenopausal. And for women diagnosed with breast cancer, soy was linked, as I mentioned, to a reduced risk of recurrence. The Women's Healthy Eating and Living study, right? Researchers found that women who ate the most soy cut their risk of cancer coming back or cancer death in half. So please absolutely enjoy your soy. Eat those whole soy foods, though, things like edamame, tofu, tempeh, and soy milk, as opposed to things that are made with that sort of soy protein isolate. If you have to pick those tofu, tempeh, edamame.
So we have another question here, which is, should I avoid wearing wired bras? This is a common concern women have because of the proximity of the metal to the breast tissue. And what we know is that there is no research showing an increased risk between underwire bras and breast cancer. So as far as we can tell, they are safe to wear.
All right, next question up. This is one of my favorites. Thank you to whoever asked this. What are the best foods to eat for breast cancer prevention? All right, and again, I'm going to use the word risk reduction because you can't necessarily prevent, but you can lower your risk. All right, of course, fruits, vegetables, whole grains, legumes. You cannot go wrong if you are eating any of those food groups. But in particular, you want to focus on higher fiber plant foods. Why is that? For every additional 10 grams of fiber a woman consumes daily, her breast cancer risk drops by 7%. So very exciting. I also have a couple of specific plant foods I like people to focus on. Cabbage family vegetables, also known as cruciferous vegetables, which, fun fact, is because their flowers are shaped like a cross. They have 4 little petals. Those are vegetables, again, like cabbage, broccoli, kale, collard greens. They all contain breast cancer fighting, this is a mouthful, isothiocyanates. And the actual MVP here when it comes to isothiocyanates, broccoli sprouts. So if you like them, they add a real spicy kick in a sandwich or a salad. If sprouts aren't your thing, arugula is another super easy way to get this. And then finally, eat the rainbow, because all these different pigments, the colors in plant foods, tend to have cancer fighting effects. So high fiber plant foods, get those cabbage family, vegetables in there, and then eat the rainbow.
Well, we have another question here, and it's about mammograms. And the question is it necessary to get a mammogram every 6 months? How often should it be? This is such an area of confusion because there are so many different guidelines out there about whether we should start mammograms at age 40. And that's a little bit controversial. Should it be every year or every other year? And then most expert groups do agree about getting mammograms starting at age 50. But let's talk a little bit about mammograms. First, they are a screening test meant to detect breast cancer that isn't clinically declaring itself. In other words, there's not a lump a woman feels or any abnormalities that she has noticed in her breast. So as a screening test, mammogram is not a perfect test. It has some helpful features and some features that can lead to problems. There are 2 major problems associated with mammograms. One is what we call a false positive, and the other is overdiagnosis. A false positive means that a mammogram will pick up something that looks like an abnormality, and that will lead to further evaluation, perhaps even a biopsy. But there is nothing wrong, but it does lead to unnecessary testing and obviously stress for women. The false positive rate is quite high with mammograms. The other problem with mammograms is what we call overdiagnosis. And what this means is that the mammogram will pick up a breast cancer that wouldn't have caused a woman any problems at all. In other words, she would have died with it rather than from it. However, because this tumor is now picked up and we don't know which way this tumor will go, she will undergo invasive surgery, maybe radiation, and these procedures themselves can lead to long-term problems. So the bottom line on mammograms is it's really an individualized decision that you should make. Discuss it with your healthcare provider, talk about the risks and the benefits, and then really it's up to each woman to decide where she stands in her risk-benefit analysis. Not a straightforward question and answer, unfortunately.
All right. Thank you, Dr. Rahman. Now, I will say that the next question coming up actually does have a nice, clear answer. Don't you love that? So it's a 2-part question. It's one we got beforehand and one we're getting live. And one is, are there certain foods that should be avoided? And then should we start drinking a drink of alcohol every day to prevent cancer? All right. The answer to those questions kind of goes together. So you might be able to figure out where I'm going with this. So one of the foods that you absolutely, again, we're going to call food. One thing you want to avoid in terms of intake when it comes to breast cancer is, and I am so sorry to be the bearer of bad tidings on this, but I'm glad to have the opportunity to let people know, is alcohol, right? And this is especially unfortunate because I think we can all agree that this is a stressful time. And truly, drinking has gone up amongst women from the same time last year. It's actually from May and June of this year. Drinking among women was up 17% compared to the same time last year. Frequency of heavy drinking among women up 41%. Why is that such a big deal? Well, for premenopausal women with each drink daily, this is based on multiple studies, they have an increased risk of developing breast cancer by 7%. So if you're having 2 drinks a day, it's a 14% increase in risk and so on. For postmenopausal women, the effect is amplified, right? So every drink being consumed daily, breast cancer risk increases by about 13% and so forth. Why? Why does that happen? So unfair, right? Why does this happen? Alcohol causes oxidative stress. It can directly damage DNA, right? And those are the directions that your cell uses to know what it's supposed to do, when it's supposed to grow, when it should not. And it also raises estrogen levels. And I think we'll probably talk about this later. I'm guessing a question's going to come in on this, that estrogen can act like fuel on the fire for breast cancer cells that have estrogen receptors on their surface. So you definitely want to avoid alcohol. Even red wine, there had been some question mark about, well, maybe the resveratrol in red wine can somehow be protective. And the answer is does not outweigh the effect of the alcohol in the wine. So sorry about that. Any kind of alcohol, not good. It's especially bad though in when the breast tissue is forming. So especially bad in young women, in teens. We really want to avoid it then. You always pretty much want to avoid it. All right. Another food you want to avoid, red and processed meat. It's linked to increased breast cancer risk. And again, we're seeing this pattern where especially in the teen years, right? As the breast tissue is forming, breast tissue is more sensitive to cancer-causing substances in that time. So really good to avoid that. And then finally, this isn't a big shock, I'm supposing, to anyone, but sodas and those highly processed foods, again, those very high glycemic index, low fiber, everything stripped away, and you're just sort of left with empty calories. Those are the foods that you also want to avoid in terms of lowering your risk.
Thank you, Lee. We have another question here. What are your thoughts on supplements? Should I take any to reduce cancer risk? So let me just say a few things about supplements. First, the supplement industry, unlike prescription medications or over-the-counter medications, is not regulated by the FDA. And what that means is that supplement manufacturers do not have to prove that their products are effective or even safe before they can market or sell them. And this is concerning because they can make different claims and the FDA allows them to do that. So what that means is we just don't know if a lot of these products that are being sold for breast health are safe or even harmful. Having said that, there are no known specific supplements that have been proven to be effective, but anyone who's following a plant-based diet should take a B12 supplement, because that is one of the few things that we cannot reliably get from plants. And hopefully everyone is following a plant-based diet to reduce their risk of breast cancer. And depending on you and your physician's comfort level, you may or may not need vitamin D supplements, but generally speaking, other supplements are usually not necessary.
All right. Thank you, Dr. Rahman. And just a reminder that we want to keep those questions coming in. So if you've had any question on your mind about breast cancer risk, what you're eating, what you're drinking, anything to do with lifestyle and breast cancer, now is your chance to ask a dietitian and a doctor together. We have another question that came in. Can diet or any foods reduce breast density? So that is a great question. The first question is, well, why do we care about breast density? Because increased breast density is linked to an increased risk of breast cancer. And the answer is, yeah, there are a couple of things that we can do in terms of lowering the density of breast tissue. First, and again, and it comes back to alcohol. Sorry, guys, but avoiding alcohol is good. The more alcohol a woman consumes, that is linked with increased breast density. So that might even be one of the mechanisms. And then high energy density diets, that's a very technical term, but basically diets that are higher in fat and calories. So really pretty much the standard American diet is linked to increased breast density, whereas these lower calorie density foods, which are fruits, veggies, whole grains, legumes, so beans, split peas, lentils without all the added oil, those are all very low calorie density foods. So those are going to actually have, they are not going to be associated with increased breast density. So again, avoiding alcohol and avoiding that sort of standard American diet.
Thank you, Lee. Our next question is, I think, a common one that many women are wondering about. Can birth control pills cause breast cancer? Now, the reason for the concern is birth control pills, we do know, contain synthetic estrogens, and estrogen exposure is linked with breast cancer. However, the majority of the research suggests that the use of birth control pills does not increase breast cancer risk. And in fact, most women can safely use them including women who may have a family history of breast cancer. Any woman who herself has been diagnosed with breast cancer should avoid birth control pills. But for the majority of the women, as far as we can tell based on the research data, they do not increase the risk.
All right. Thank you, Dr. Rahman. I'm guessing plenty of women were interested to hear the answer to that one. Next question. Does a ketogenic diet affect breast cancer risk? What about vegan keto? All right, great questions. So first, I actually went back through the literature to make sure I hadn't missed something because I had actually just tackled this question a couple of days ago. And there's no data that I know of suggesting that a ketogenic diet can lower breast cancer risk. What we do know, the foods that are linked with lower breast cancer risk tend to be higher in carbohydrate. Again, those are those good carbs, those fruits, vegetables, whole grains, legumes, even nuts and seeds. They come with that cancer-fighting fiber and phytochemicals. You are not going to get a whole lot of those on a ketogenic diet. Now, I'm guessing this came up because there's at least one study that found about a 20% lower risk of estrogen receptor negative, but not estrogen receptor positive, which is more common, but 20% lower risk of estrogen receptor negative breast cancer in women who consumed diets lower in carbohydrate. But there was a caveat here that was only if they focused predominantly on plant-based food. So not necessarily vegan, but if they're lower carbohydrate diets, the protein and fat was coming more from plants, then there was that lower risk of that one type of cancer. But the same study also found that the DASH diet, which is rich in carbohydrates and includes lots of fruits and vegetables, was equally protective. And the strongest link in the same study that they found was for eating lots of fruit, which that's a no-no on most ketogenic diets, and those non-starchy vegetables, those were linked to a 29% lower risk, again, of that estrogen receptor negative breast cancer. And then I want to tie into the only diet style we know of that's been proven in a clinical trial to actually reduce the risk of breast cancer, of not just getting it, but of dying from it, which I think is what we're all actually worried about. That was a diet low in fat. It was around 20%, a little more of calories from fat, and high in vegetables, fruits, and grains. So again, basically the opposite of a ketogenic diet. This was a Women's Health Initiative study trial, and they followed more than 48,000 postmenopausal women for nearly 20 years, so super long. This is a really big long-term trial. And women eating a low-fat diet, again, rich in those fruits, veggies, and grains, had a 21% lower risk of dying from breast cancer. And for those women who got a diagnosis, there was actually a 15% lower chance of dying from any cause when they were following that same eating plan. So a ketogenic diet is not recommended for reducing breast cancer risk.
Thank you, Lee. Really important questions. I know the keto diet comes up all the time. Now, the next question is, at what age should I start screening for breast cancer? So this question is really tough to answer because it really depends on your risk, what your family history is, whether what your health is like. And let me just emphasize again that there are many different societies that have many different recommendations. Generally, screening for women under 40 is not recommended. 40 to 50 is the gray area where some people recommend annual screening, whereas others may recommend every other year or no screening. And then most guidelines recommend screening at age 50. However, we do need to be cognizant of the harms associated with screening. So for the rates of false positive and overdiagnosis are quite high. Let me just share some numbers with you. As far as overdiagnosis, that's where a tumor is picked up that would have never caused a woman any problem. The rates of overdiagnosis is anywhere from 10 to 50% of all breast cancer cases could represent overdiagnoses. So not an insignificant amount. And similarly, the other risk is false positive with mammograms. And let me share some numbers here with you also. In the United States, about 10% of screening mammograms are false positives. And after a decade of annual screening, about 50% of women will have experienced a false positive. And if you've experienced a false positive, you know just how stressful that is and how much further evaluation it leads to. So really not an easy question to answer. It's best, again, to discuss with your healthcare provider your specific situation, and then to really weigh in your comfort factor about screening versus not. Back to you, Lee.
Okay, thanks, Dr. Rahman. All right, we have a question from Christine. What types of phytoestrogens are good to eat for breast health that won't affect endometriosis? Excellent question. So the phytoestrogens that most of us are thinking about here, I think, are going to be found in soy, right? And it turns out one of the reasons that soy is likely linked to a lower risk of breast cancer is actually because of those phytoestrogens. Now, that might confuse some people because we just talked about estrogens, the biological estrogens in your body can actually fuel breast cancer growth. So how could it be that phytoestrogen consumption can reduce breast cancer risk? And actually, fun fact, in terms of endometriosis, the studies have been very mixed, but it looks like soy foods, there's either no effect or there might be a beneficial effect in terms of endometriosis. So there have been studies showing that it can make it a little worse, studies showing no effect, and studies, as many or more, showing that it can have beneficial effects. So it is unlikely at this point, from what we can tell, to cause any problems to eat soy for endometriosis. But I want to talk about the hormone side when you're eating soy and that phytoestrogen. So those isoflavones that I talked about in soy, those are actually phytoestrogens, right? And they don't act in the body the same way as your own estrogen does. And that's the key, right? So why those phytoestrogens, I should say your own estrogens, there are two kinds. There's estradiol for women who are premenopausal and estrone is the primary in women who are postmenopausal. There are also two kinds of estrogen receptors, and this is the key. So there is an alpha estrogen receptor, and I like to think of that as the alpha is the accelerator, right? It promotes the growth of breast cancer cells. It's like the accelerator on a car. When estrogen binds to it, boom, like stepping on the gas. There's also a beta or the brakes receptor, and that actually helps block cell growth that's part of the cancer process. Now, estrone, which is that main estrogen form in women after menopause, binds mainly to the alpha, the accelerator. Let's do this. That receptor is what your own estrogen is binding to, whereas the phytoestrogens, the isoflavones in soy, bind to those brakes. The beta receptor, right? Slow down the cell growth that's part of the cancer process. So that's one of the reasons they think that soy and the phytoestrogens or isoflavones in soy are actually beneficial because of which estrogen receptor they're triggering and the effect that has in the body. So the answer to that question is go ahead and have those soy foods. The data suggests there's probably no effect at all. There might even be a beneficial effect in terms of endometriosis. But again, I would stick to the things that are more whole in form. So something like tempeh or edamame as opposed to something made with like an isolate as an ingredient in a very long list.
Thank you, Lee. Speaking about screening for breast cancer, another question that often comes up is, should I do a breast exam, a self-breast exam, and how often? You know, when I was in medical school, we were taught that we should tell our female patients to do a self-breast exam every month. And back then when we were getting the phone bills, you know, do it when you get your phone bill or do it on the first of the month. But what we know is that multiple research studies have shown that there is no survival benefit with self-breast exam. And in fact, it leads to higher rates of diagnostic studies and imaging and biopsies. So that doesn't mean we don't need to be mindful of our breast health. It just means that if you feel something unusual in your breast, you know, during your activities of daily living, then definitely bring that to your healthcare provider's attention. But specifically examining the breast to look for a mass or something suspicious hasn't shown to be effective in research studies.
Okay, we've got one here in terms of organics. Should I choose organic foods, particularly soy products? So the answer is yes. If you choose organics, there's just not a lot of data here. And I have not been able to locate anything specifically on soy and choosing organic soy. Now, certainly if you choose organic, you will avoid some of the pesticides that are used or herbicides that are used on the sort of more GMO soys. So that's something to think about. But there actually is a little bit, I've seen one study in terms of produce, finding that consuming organic produce at least half the time was linked to a lower risk of breast cancer compared to consuming no organic produce, but not to low organic produce levels. So the answer to that is, in terms of soy, the jury's out. We don't know. Again, it's certainly better to be eating soy products than to eat what the alternative is. For most people, they might eat a veggie burger with soy in it or a cow burger. For heaven's sake, please eat the veggie burger. So again, given the choice between a soy product that's conventional and something else, eat the soy product that's conventional. If you have the means, I think it would be reasonable to go ahead and choose organic if you can, but if not, to not sweat that too much. But back to the produce study, there is that little suggestion. One study does not mean, the end all be all. It's just an interesting indicator, but it does suggest that, hey, if you can afford or have access to organic produce, and go ahead and grab it. And if you can't, still so important to eat the produce, because organic or conventional aside, most people are buying conventional produce. The links to fruits and vegetables and lower breast cancer risk are very strong. So buy the conventional produce. If you can afford to, you might want to buy organics when you can. It's nice if you want to look at the Dirty Dozen from the Environmental Working Group. That can kind of help you prioritize where to spend that organic food dollar, if that's something that's important to you. But if not, I would suggest it. Again, it's less critical than the overall style of diet that you eat. And we want to have that being plant-based and focus on lots of fruits, veggies, whole grains, and beans.
Thank you, Lee. That's one that comes up all the time, organic versus not. And here's a question about vitamin D. So the question is there a link between low vitamin D levels and breast cancer risk? And also, is it possible for obesity to cause low vitamin D levels? So let me answer the one about obesity first. Obesity is associated with lower levels of vitamin D, but we don't know if there's a cause and effect yet. We just know there's an association. So we can't draw any more from that than that. Now, the other question is about levels of vitamin D and breast cancer risk. So we do have some research evidence that in women who are premenopausal, there is no association between vitamin D levels and breast cancer risk. However, in women who are postmenopausal, women who've undergone menopause, we do know that their risk of breast cancer decreases as their vitamin D levels increase, but it's within a very narrow range. Just when the vitamin D levels are between 27 and 35, as the vitamin D levels increase, the risk of breast cancer decreases. But then beyond that range, there was no clear correlation. However, there is a trial that's ongoing. It's called the VITAL trial, and that will be ending in November of this year. And that is specifically testing the role of vitamin D in many conditions, including breast cancer. So we should have more information at that point. But I suspect we probably won't get the results till sometime next year.
Okay, it looks like we have one last live question here, and that is, should we have our young daughters start eating soy in their teens? And the answer here is yes. So we have some data suggesting that we have a benefit to soy, and it's certainly good to go ahead and include that in your diet if you like it, of course, at any age, but it appears to be most beneficial when it is consumed as breast tissue is forming. So yes, absolutely. I think it is very prudent to have daughters eat soy in their teen years, and also to avoid those red and processed meats. Every time I go to the grocery store and I see a mom in the meat aisle grabbing some ham slices to put on their kids' sandwiches, a little piece of me just wants to, it's like, oh, a little knife in the heart, like, because these moms are trying to do the best they can and they don't know. So yes, avoid the red and processed meats, and absolutely have your daughter start eating soy now would be good. All right. So I think that covers us in terms of the Q&A for right now. So thank you, Dr. Rahman, very much. We appreciate it. And we are excited now because we are going to, this is our big reveal, because we partnered with some of our favorite celebrities to bring Let's Beat Breast Cancer's 4-pronged approach to you. We've got Ted Danson, we've got Mary Steenburgen, Alicia Silverstone, of course, Dr. Christy Funk, and Jasmine Leyva of The Invisible Vegan. They all teamed up to bring this life-saving information right to your home. So without further ado, here is the new Let's Beat Breast Cancer PSA.
1 in 8 women will be diagnosed with breast cancer.
But only 10% of your risk is related to genetics. For that other 90%, we can take steps to protect our health and reduce our risk by
choosing healthful plant-based foods,
getting active and exercising regularly,
limiting alcohol consumption,
and number 4, aiming for and maintaining a healthy weight.
Join us in taking this 4-pronged approach to beat breast cancer.
All right. So I hope everyone enjoyed that, and a big thank you and shout out to our celebrity partners for being a part of it. So again, if you haven't already, zip on over to letsbeatbreastcancer.org and take the pledge, and then share it. Share it with a friend, share it with your supporters. Thanks so much.